This is important. And coming to the Samprapti of the Panduroga, mainly Sadhaka Pitta. Okay, Sadhaka Pitta, which is situated in the Hridaya, that will increase. That is happening in the Panduroga. And the Sthana Samshaya is mainly occur in between Tvak and Mamsandara. Okay, that is important. So, where is the Sthana Samshaya of this Panduroga is taken place? Between Tvak and Mamsa. So, you can write the code here as TPM. TPM. So, T for Tvak and P for Panduroga, M for Mamsa. Okay, so that is the code for Sthana Samshaya of this Panduroga. Okay. And coming to the next point of this Panduroga, that is Dushya of this Panduroga. That is very important. So sometimes this question can be asked, the Dushya of the Panduroga. So mainly 5 in number. Dushya is 5 in number. That is Kabha, Vada, Asrit, Tvak, Mamsa. Okay. So it is 5. Kabha, Vada, Asrit, Tvak, Mamsa. But in Ashtanga Hridaya, Acharya mentioned only 4. So except Vada, other Dushyas are mentioned. So in Ashtanga Hridaya, Vada is not mentioned. Okay. And in Sushruta Samhita, Acharya mentioned about the Rekta. Rekta is the Dushya. Okay. So the main point, that is Dushya, very important. Charaka mentioned 5 and that of Ashtanga Hridaya 4 except Vada, and Sushruta mentioned only 1, that is Rekta. Okay. So whenever you choose the answer, please note the which Acharya mentioned. Okay. So Acharya, Sushruta mentioned only 1, which is that Rekta. So you can write here the code, that is when Pandu ho jaye to Kadam. Kadam. That is K-A-T-A-M. Okay. The K for Kaba, A for Asrit, T for Tvak, and Mamsa. Okay. Right. Then we can move on to Purva Rupa. In Purva Rupa, you have to learn about the mainly Hriday Spandana. Okay. Hriday Spandana is the Purva Rupa of Pandu, and Sweda Abhava. That is an important point. Sweda Abhava and Raukshyada and Hriday Spandana. Okay. And in Sushruta Samhita, Acharya mentioned Tvak Spudana. That is cracking of the skin can be occur. And some people may have Mrit Bhakshana. Okay, eating mud, and Prekshana Kuda Shofa. That is important. So please note, Prekshana Kuda Shofa is a Purva Rupa of Pandu by Sushrutacharya. Okay, and Hriday Spandana is very, very important. You may feel that when the patient who is having this type of anemia, especially this iron deficiency anemia, they feel palpitation. Okay, so you can correlate like this, Hriday Spandana. Okay, then coming to the Samanya Lakshana of Panduroga, Karnashvedi, that is tinnitus can be occur, and Hada Analaha, Indigo Udeshtanam. Okay, and Shuna Akshikudo, Harida Shirna Lomaha, and Hada Prabaha. So mainly these points, that is Karnashvedam and Hadanalam, and Jara can be occur, and Shishiradeshi, very important point. That is the Samanya Lakshana of the Panduroga. Okay, Shishiradeshi and Alpavak and Shtivana. Okay, Shtivana and Alpavak. Okay. So mainly these points. And in Ashtanga Hridaya, that is Dadu Shaidilyam, Shladadendriyam, Hridaya Dravada, and Alparekta Medas and Nisaraha. Okay. So Nisaraha, it's very important. Okay. And also Hridaya Dravada. So Hridaya Dravada is the symptom, whereas Hridaya Spandanam is the Purva Rupa of the Pandu. Okay. So these are points you have to study in symptom of this Pandu. Okay. Then coming to the Mrajanya Pandu. Mrajanya Pandu Lakshana. Actually, this is mainly occurring in the children's. Okay, they have a tendency to take this mud. Okay, and we can correlate this as the iron deficiency, anemia, and all. And mainly Mritbhakshana Janya Pandu, the symptoms are Shuna Akshikudaha. Shuna Akshikuda and Bru Pada Nabi Mehana. Okay, so this edema can be occur on these areas: Akshikudam, Gandam, Bru, Pada, Nabi, and Mehana. And Krimi Koshta. Krimi Koshta will be there. And Adisara with Kaba and Rakta. That is an important symptom. So there may be the motion which is mixed with mucus and blood. That is the classical symptom of Mritjanya Pandu. Okay. So please note it. Adisara with Kaba and Pandu. Okay. And next important point, that is Pandaroga Asadhya Lakshana. Okay. So whenever this Pandaroga, which is Chira, okay, Chira and Gari Buddha Deha and Shuna Anga, that is edema is present, and as well as Pidani Pashyati, the patient sees all the things in yellow color, Pidani Pashyati. This is the Asadhya Lakshana of the Pandu. And Andeshu Shunaha Parihina Madhya. That is Shuna in hand, leg, shoulders, okay, and Shosha for Madhyama Bhag, middle part of the body. And this is also Asadhya Lakshana. Important thing, that is Andeshu Shuna Parihina Madhya. Okay, this quotation is very important. Andeshu Shuna Parihina Madhya. This is the Asadhya Lakshana of Pandu. Okay. Then coming to the Chikitsa Sutra of this Panduroga, Tatra Pandhamai Snigdha Tishner Urda Anilomigehi Samshodhi. So mainly Samshodhana is indicated and Tikshna Urda the Samshodhana. Okay. Urda the Samshodhana is indicated for Pandurogi. That is a 2-star important point. And Charagajara explained that in Vadiga, predominant Pandu, Sneha Chikitsa, and in Pitta, Tikta Shidala can be used, and in Shleshma, Kadu Tiktoshna can be used. Okay. And Saptaratra Gomutra Dhara Bhavida Loha Basma Prayoga can be given in Panduroga, and its Anupana is fire. That is also a 1-star important point. And next point, that is Gomutra Haridagi is indicated in Kabaja Panduroga. Okay, Kabaja Panduroga, Gomutra Haridagi is indicated. And then for Videchana, we can give that is Charagajara mentioned Virechana as a treatment of this Pandu, and this Virechana should be done in the order that is Alpa Alpam. So Alpa Alpam for several times. Otherwise, this Virechana will cause Shrayatu. Okay, so Virechana should be done Alpa Alpam for several times. Okay, and here the Svedana Karma is contraindicated, and we can advise this Shodha Chikitsa in Panduroga. Okay, so Shodha Chikitsa can be advised in Panduroga, and the main complication of Panduroga is Shofa. Okay, Shofa is the main complication of Panduroga. Very important. And coming to the Mritbhakshana Janya Pandu, which is the treatment Tikshna Shodhana. Tikshna Shodhana is mainly indicated. And for Kamala and Panduroga, we can advise Pandavya Vridam, Mahatiktagam, Kalyana Vridam for Snehana purpose. Okay. Understood? If you have any doubt, you can ask me. Okay. And for Snehana purpose, we can give these Gridas. And some yogas are mentioned in the Pandu Chikitsa. So let's study what are the yogas. That is Dadimadi Gridam. Very important. So in which context or in which Yogadhikara Dadimadi Grida is explained? Panduroga. And its indication is Muda Vadanulomana. Okay. So Dadimadi Grida, Muda Vadanulomana. And Kadugadi Grida, Patyadi Grida, and Vasha Guluchyadi Kashayam is also mentioned. So Vasha Guluchyadi Kashayam is mentioned for Pandu Pittasra Kamala. It's indicated that Pandu Pittasra Kamala. Okay, very important. Then Agraushada for Pandu, which is the Agraushada Ayoraja. Okay, Ayoraja is the Agraushada of the Pandu. And in Pandu, Punarnava Mandura is also explained, and it should be taken in Kola Pramana, Punarnava Mandura. Okay, and coming to the Arishta, the name of Arishta is very important. 3 Arishtas are mentioning in this Pandu Rogadhikara, that is Gaudarishta, Bijagarishta, and Dhatri Arishta. So the 3 Arishta very important: Gaudarishta, Bijagarishta, and Dhatri Arishta. Okay. Then we can learn about this Kamala. Okay, Kamala, you know that Pandurogi, when the Pandurogi excessively intake the Pitta Pragoba Ahara, and also doing the Pitta Pragoba Vigara, then there is a chance of developing this Kamala. Okay, and the Lakshanas are explained here. So, Rekta Pida Shagrit Mutro, Vekhaba Varno, Hatendriyaha. So, this is the symptoms of Kamala, and it is of 2 types. The type of Kamala, that is Koshta and Shagashra Kamala. Okay, Koshtashrada and Shagashra. Very important. Okay, so Kamala, Koshtashrada and Shagashra Kamala. And the Dadus, that is Mamsa and Rekta Dadus, become Degda due to the Pitta Koba in Kamala. So, which are the Dadus which undergoes Degda, Mamsa, and Rekta? Very important. Okay. So, we have studied the Dusha of Pandu, and the Dadus which undergoes the Dagda is Mamsa and Rekta in Kamala. Okay. So, you can write the code as Kamara. Kamara, Kamara. That is in Kamala, Mamsa, Ma for Mamsa and Ra for Rekta. Kamara. Okay. And what about this Kumbha Kamala? That is the Kamala which is chronic in nature. That is Kalandara Giribhuda. And it is Kritra Sadhya. So, Kumbha Kamala is Kritra Sadhya. So, you can write 3K. K is Kumbha Kamala, Kalandara Giribhuda, and it is Kritra Sadhya. Okay. And the Lakshanas are Krishna Pida color to the Shagrat, Mutra, and Netra. And Rekta from Mukha, Akshi, Vit, and Mutra. And also Mahashofa and Parva Beda can be occurred. This is mentioned by Sushrudacharya. And Asada Lakshana is Nashta Agni and Sapnya Nasha. So this is the Asada Lakshana for Kumbha Kamala. Okay. So Kumbha Kamala, you have to mainly remember the code 3K, and it is Kritra Sadhya. Okay. Then next we have to learn about Shagashada Kamala Roga. That is mainly the Shagashada Kamala, what is happening? That is the intake of Ruksha Shida Gudvadu, Vyayamir, and Vega Nigrahi. Kaba Samurchido Vayu, Sthanat Piktam Shipet Bili. Mainly, it goes the Pitta. That is Kaba along with Vayu will cause the displacement of the Pitta in that in the Shagashada Kamala. Okay. And Haridra, Netra, Mutra, Twak, and Shveda Varcha. So Shveda Varchas is mainly seen in Shagashada Kamala, very important symptom. Okay, Shagashada Kamala, Shveda Varchas. Okay, so Tilapishta Nibam. Some acharyas mentioned it as Tilapishta Nibam. Okay, Shveda Varcha, Shagashada Kamala, that is very important symptom. Okay. Then coming to the treatment principle of this Kamala, that is Mridu Virejana is indicated. So Mridu Virejana with Tikta Drivya, and Anjana for Kamala is mentioned. That is also very important. That is Nisha Deviga Datri. The Anjana that is used for this Kamala is made of Nisha Gairika Dhatri. Okay, this is very important. Nisha Gairika Dhatri, that is used for Anchana, and Mrudu Virejana with the Tikta Dravya is indicated. And what about the treatment principle of this Ruddhapada Kamala or Shagashruda Kamala? So another name for Shagashruda Kamala is Ruddhapada Kamala. Okay. So Tilapishnibbam yastu Kamalavan Srijit Malam Kaba Ruddhapada Tasya Pittam Kaba Harer Jiyet. Okay, that is the treatment principle. Kaba Ruddhapadam Tasya Pittam Kaba Harer Jiyet. Okay, so mainly we have to adopt the Kabatna treatment, and this Vada Kaba Koba is mainly occurring in the Shagashadaka. Okay, and that will cause the displacement of Pitta from Koshta to Shaga. So we have to adopt the main treatment to bring this Pitta normally into the Koshta. Okay. And in Shagasudha Kamala, the Lakshana that we have already learned, that is Pida color to the Tuk, Netra, etc. and white color to the Purisha. Okay. And treatment principle is Vada Kaba Shamanam and Pitta Vardaka. Please note Kaba Vada Shamanam and Pitta Vardaka are mainly we are giving the treatment in Shagasudha Kamala. Okay. And coming to the treatment principle of Mritjanya Pandu. Mainly we can give Tishna Shodhana, and after that, after this Tishna Shodhana, Grida Prayoga can be done. Okay, Grida Prayoga. Especially we can advise Vyoshadi Grida, very important. The Grida which is advised in the Mritjanya Pandu is Vyoshadi Grida. Okay, and also Kashaya Rasa Bhavida Mrit. That will cause the person to aversion towards that Mrit. Okay, so Kashaya Rasa Bhavida Mrit is also given to that patient to produce aversion towards the Mrit. Okay, Mrit or Mat. And next is the treatment of Kumbha. So we have studied that Kumbha Kamala 3K, and here we can give Kanmada. So 1K you can also use for remembering Kanmada in Chikitsa. Kanmada in Gomutra can be given for 1 month in Kumbha Kamala. And Makshiga can be given, or Purana Kitta can be also advised for 1 month. Okay. Understood? So these things, Makshiga, Kanmada and Purana Kitta. Any one of these can be used for 1 month. Okay. And next is Halimaga. So Halim, the point you have to remember is it is the synonym is Lodara and Alasa. The synonym is Lodara and Alasa, and its dosha pradhana is Vada Pitta. So Halimaga dosha pradhana is very important. It is Vada Pitta, and synonym is also important, Lodara and Alasa. Okay. Understood? And the Lakshana is in Halimaga, what is the Lakshana? Bala Ulsaha Kshaya, Tandra, Manda Agni, and Mrudujvara, Strishu Aharsham. So please underline that, that is Strishu Aharsham, and Bala Ulsaha Kshaya and Tandra is mainly happening in Halim. Okay. Then Chikitsa of Halimaga is also important. That is, we can give Drakshavaleham and also Yabanavasti. Abhaya Leha, which is mentioned in Kasa Chikitsa, can be given in Halimaga, and Guluji Swarasa Kshira Sadida Mahsha Gridam is also indicated. Okay. So Halimaga, you have to learn about the dosha pradhana, that is Vada Pitta, and its synonym is also important. And we can give the treatment of this Halimaga, that is Guluji Swarasa Kshira Sadida Mahisha Gridam. Okay. This is important. Then and these are the Rogatikara that we have already discussed these points. Okay. And Dadimati Prada, one more indication, that is Dukha Prasavaneenam cha Vandhyanam cha Garbhada. Okay. Udavadanulomanam is the one of the indication for Dadimadi Vrida. Another indication is Dukkha Prasavaneenam cha Vandyanam cha Garbhada. So Dadimadi Vrida is very important. I think you have studied this yoga completely. Okay. So Dadimadi Vrida is very important. And next is Navayasa Churnam. Mainly Trushana, Tribala, Musta, Vidanga, and Chitraga. It's in Sama Pramana. And Loha Basma is mainly present. That is Nayan Bhaga of this Navaya Churna is Loha Basma. Okay. So the Anupana is also important. Shaudra and Sarpi. So Navaya Churna, Anupana is important. And the main ingredient is Loha Basma. Okay. And also you have to remember in which context this Navaya Churna is explained. Okay. Then one more point that you have to remember is the Panduroga Paryaya, which is mentioned in the Sushruta Samhita. That is, Acharya Sushruta mentioned Kamala as a synonym for Panduroga. Okay, so which Acharya mentioned the synonym Kamala as for the Panduroga? Sushruta Acharya. Okay, and another symptom is Panagi, Kumbhaha, Lagaraga, and Alasakya. Okay, so that is three-star report. Okay, three-star report. Then, so mainly these are the points. So we can revise this Pandaroga, that is it is 5, 4 and 8 type, and 4 by Sushrutacharya, 8 by Harida, another Acharya is mentioned 5, and its Sthana Samshra is mainly of the Tok and Mamsa, and Pandaroga mainly which Pitta is increasing? Sadhaka Pitta. Okay, and dosha of this Pandaroga we have studied with the code Khatam. Okay, 5 doshas, and Acharya Sushruta mentioned only one, that is Rekta. And we have learned about the Arishta, Gauda Arishta, Bijaga Arishta, and also uh, one more Arishta, that is Dhatri Arishta. Okay, that is very important. And also we have learned about the Kamala. That is 2 type of Kamala, Shakashrida and Koshtashrida. And Uddhapada Kamala is a synonym for Shakashrida Kamala. And mainly in Shagasudha Kamala, the Purisha Varna is Shveda or Tilapishta Nibam. Okay, and Kumbha Kamala 3K, and we can use Kanmada or Purana Kitta in the treatment aspect of Kumbha Kamala. Then coming to the Mutbhakshana Janya Pandu, Tikshna Shodhana is indicated and Vyoshadi Gruda is indicated in that context. Okay, mainly you have to cover these points. Okay. And for mainly for Grudapana, we can use Kalyanagam, Panchatavyam, Mahatiktagam, Aragvadadi. Okay. So additionally, Ashtanga Hridaya mentioned Aragvadadi, Siddhagruda. Okay. So these are the important points. At least you have to cover these points while revising this Kaya Chikitsa in your last preparation. Okay. Then let's start the next disease. Dr. Asia, any doubt? Which part I have to repeat? Kumbha Kamala, okay. Actually, Kumbha Kamala is the Kamala which is produced by the chronicity of this Kamala. That is Kalandara Teribhuta. Okay, that is the symptoms mainly explaining for the Kumbha Kamala. And coming to its prognosis, it is Krucha Sadhya. Okay, and its Lakshana is mainly Krishna or Pida color to the skin and Shagat Mutra, and Rekta can be occur from the Mukha and Akshi with Mutra. Okay, and its Asadi Lakshana is Nashta Agni and Sapnyanasha. And coming to the treatment aspect of this Kumbha Kamala, we can give Kanmada or Purana Kitta and Makshika. Any one of these can be used for 1 month. Okay. Okay. Clear now? So, can you see this screen of Vadarekta?
Yes, ma'am.
Okay. Mahashofa actually the Sushrutaracharya mentioned as a symptom of this Kumbha Kamala. Okay. Mahashofa. Okay. So let's start with the Vadarekta. Mainly in this chapter, you have to study the two type of this Vadarekta, that is Utthana and Gambhira. Okay. You know that Utthana, that is Tok Mamsashrayam, and Gambhiram, that is Andarashri, that will penetrate into the recta, mamsa, medas, and all these dhatus. Okay. Uttanam, Tong Mamsashrayam, and Gambhiram, Andarashri. Okay. And the synonym of this Vadarekta is important. That is Vada Shonidam, Guddam, Vada Valasam, Atyavada. Okay, so one point that you have to remember is that Atyavada is the synonym given for Vadarekta by Charagacharya. Okay, whereas in Ashtanga Hridaya, Atya Rogam is the synonym. Okay, so Atya Rogam is synonym given Vagbada and Atya Vadyam by Charagacharya. And in Ashtanga Hridaya, the synonym Urustamba is Atyavada. Okay, clear? So these synonyms are very important. And coming to the Hedu, I will not repeat the same portion. Okay, this will actually the Vadarekta Hedu is Achankramana Shilinam and also in Sugumarana. It is mainly occurring these kind of people. And what is mainly happening here? Vada will vitiate along with the Rekta. Okay, and coming to the next point, that is the Purvarupa of Vadarekta. Mainly it is Pushtasama. That is important. Bhavishadaha Pushtasamam. Vakbadacharya mentioned the Purvarupa of this Vadarekta as Bhavishadaha Pushtasamam. That is very important. And coming to the next, that is Parsha Aknyada can be occur. And Sfuranam. Sfuranam is also the Vadarekta Purvarupa. Okay. And coming to the Uttana Vadarekta Lakshanam, Ayama, Sfurana, and Agunchana are the Lakshanas. Okay, these are 2-star important. Ayama, Sfurana, and Agunchana. Whereas in Gambhira Vadarekta, Stambha, Stabdha, Kadina, Shodha, and Sfurana. Okay, so Sfurana is present in both type, and Stabdha, Kadina, Shodha is present in Gambhira Vadarekta. Okay. Then coming to the next part, that is Vadarekta Sadhya Asadhyata. So before moving to that point, the one more point I had to add, that is the Chimichimayana is a symptom of Rektaja Vadarekta. Okay. And also, if all the treatments like Snigdha, Rusha Prayoga will not cure this Vadarekta, then we will get an idea that it is of Rektaja. Okay, that is Snigdha Rushehi Shamam Nedi. Rektaja Vadarekta. So mainly you have to study the Vadarekta symptoms here. Okay. And coming to the Sadhya Sadhya of this Vadarekta, Ega Doshajam and Navami Sadhyam. Okay, and Tridoshaja is Yapyam. And Tridoshaja is Asadhyam and Dvidoshajam is Yapyam. So this is our important point. And Vadarakta Upadrava Anguli Vakrada. That is, there may be a change in the shape of these joints can be occur. Okay. Vadarakta Upadrava. So that is important. Then coming to the Vadarakta Chikitsa, mainly Rektamoshana is indicated. Rektamoshana with the Shringa, Jaloga, Alabu, Suji, Prachanam or Siddhaveda. Okay, so the indication for this, that is Jaloga is indicated in those parts with the pain or burning sensation. Okay. Whereas Shringa or Tumbi can be used in the part of Supti or Kandu Chimichimayan. Okay, this is very important. It can be asked. So Jaloga, when there is a pain or burning sensation, we can use that. And Shringa and Tumbi, that is in Supti and Kandu condition. And if it is shifting, the pain is shifting in nature, Desha Deshandaram Vrajit, then we can use Siddhaveda. And Siddhabihi Prachanam. Okay, Prachanam and Siddhaveda can be used there. Desha Deshandaram Vrajit. Okay. So it is very important. And coming to the next important point, in Bahya Vadarakta Chikitsa. So mainly in Vadarakta, Sarvapradam Snehana and Virejana or Sneha Virejana is indicated. Okay. And after that, Vasti Karma is indicated Abhyangam, Pradeham, and also we can give Sneha Prayoga. An important point, that is Bahya Vadaraktam or Uttana Vadarakta, we can give Alebanam, Abhyangam, Parishegam, Ubana. Only external management. Okay. Okay. So first thing you can remember, like this. First Abhyanga should be done before going to the bath. Abhyanga, then bath. And after that, some Lebana or cream will be applied. And then Ubanaha. Okay. Ubanaha. So you can remember like this. Okay. This is not the proper code. So you can correlate like this. And coming to the Gambhira Vadarakta Chikitsa, we can give Videjanam, Asthabanam, and Snehapan. Okay, Videjanam, Asthabanam, and Snehapan. So VAS, you can write the code as VAS. Okay, VAS, VAS can be used for Gambhira Vadarakta Chikitsa. So these 2 points are very important. Okay. Then in Rekta Pitta Pradhana Vadarakta, mainly Virechana, Gridapana, Kshirapanam, Vasti, these all treatment can be adopted. Okay. And coming to the Kaba Pradhana Vadarakta Chikitsa, mainly Kaba Vada Pradhana Vadarakta, we can give Shida Leba. Shida Leba Varjya. Sorry, Kaba Pradhana Vadarakta, Shida Leba cannot be used because this will increase the vitiation of Kaba and Vada. Okay. Whereas in Rekta and Pitta, Ushna Lebana is Varjya. So in that case, in Rekta Pitta Pradhana Vadarakta, we can give Shida Leba. And in Kaba Vada Pradhana, Ushna Leba can be applied. Okay. And the thing that is Apatya in the Vadarakta is Divasopnam, Vyayama, Guru, Abhishandi, and Levana, Amla, Ahara, and Vihara. Okay. So it is of 1-star important. Divasopna is Apatya in Vadarakta. Okay. And Abhishandi and Levana, Amla, Ahara, and Vihara. That is also important. Okay. Then coming to the Vadarakta Rogadhigara, you have to note that Sugumara Taila is indicated here and Amardhatya Taila. Okay. Amardhatya Tailam, Mahapatma Tailam, Gudaga Patmaga Tailam. Okay, so Patmaga, Gudaga Patmaga, Amardhatya, these all are indicated in Vadarakta. And Pinda Tailam is a commonly used yoga. You know that. Okay, it is very effective in burning sensation. Vadarakta Rujabaham. Okay, that is indication of Pinda Tailam. And next thing, that is Shadapaga Maduga Tailam, Shadapaga Bala Tailam. So Bala Tailam is mentioned in Vadarakta. Okay, so don't get confused that it is not indicated or mentioned in Vada Vyadi. It is mentioned in the Vadarakta. Okay, so please note that. Understood? Then one more point, that is the Vadarekta Vyadi is mentioned in Susho Samhita under Vada Vyadi. Okay, Nidana Sthana Vada Vyadi Nidan mein Vadarekta is mentioned, and its treatment of this Vadarekta is mentioned in Mahavada Vyadi Chikitsa. Okay, these 2 points are important. So, in which chapter this Vadarekta is mentioned by Sushrutajarya? Mahavada Vyadi Chikitsa. Okay, that is important. Then Vyadi Prasarana of Vadarekta. That is very important. That is Padayor Moolamastaya Kadajit Hastyorabi. That is, first, these symptoms can be occurring in the small joints, especially on the upper and lower limbs. Okay, hand and foot. Mainly it is occurring on these parts. Okay, that is the classical symptom of this Vadarekta. And it is Aghu Visha Saman. It is similar to, its spreading is similar to like Aghu Visha Saman. Okay. And its Purvaruba is similar to which disease? Pushta. Okay. These are oftenly asking, frequently asking in the entrance examination. And one more point, that is Ega Varsha Purana, that is 1 year old Vadarekta is Yapya. We have studied that Ega Doshaja, Nava is Satya, and the Doshaja and Ega Varsha Purana is Yapya, and coming to Tridoshaja, it is Asatya. This is the prognosis of the Vadarekta. Okay. Then the Rasayana Prayoga that is mainly indicated in the Vadarekta is Vardhamana Pipali. Okay. So you can write the code as people oftenly get affected with this Vadarekta. People, we can use for the Pipali. Okay. So we Pipali Vardhamana is mainly indicated in Vadarekta. Okay. That Rasayana is very important. Pipali Vardhamanam. So you can you have to read the Krama of this Vardhamana Pipali. Okay. Just read it. Then moving on to the next point, next important point about the Vadarekta, that is in Gambhira Vadarekta, mainly the symptom is Gancha and Pangu. Okay, so it will affect all the dadus, and it will cause the deformities in Sandhi, Asti, etc. And the people may have Gancha and Pangu. Okay, that is the ultimate complication of this Gambhira Vadarekta. Okay. And next point, that is Vada shown in the name, which is the important treatment. Ektamosha is the important treatment, and Nahi Vasti Samam Kindit Vada Rekta Rujabaham. Okay, so Vasti is the main treatment or an important treatment for the pain. If pain is increasing or pain is predominant symptom in the Vada Rekta, then Vasti is the main treatment. Okay, so please note this code. Nahi Vasti Samam Kindit Vada Rekta Rujabaham is, which is the context Vada Rekta. Okay, this quotation is very important. You have to study it. And Shiravasti Prayoga is indicated here for Dosha Nirharana. Okay, and next point, that is for Sadhya Shula Nivaranam, Dashamula Siddha Kshira can be used as Parishega. Okay, but in Vada Pradhana Vadarekta, Dashamula Siddha Ushna Grida Parishega is indicated. Okay, so Shira, which is processed with the Dashamula, can be used for Parishega in Sadhya Shula Nivaranam. That is very important. Okay, Dashamula Siddha Shira for Sadhya Shula Nivaranam, very important. Okay, so these points that we have studied, that is Gambhira Vadarekta, VAS is the code. Okay, and Pindatailam, Vadarekta Rujabaham, and Shadapaga Balatailam, Sahasrapaga Balatailam, and important quotation, that is Nahi Vasti Samam Kingit, Vadarekta Rujabaham. So mainly Vadarekta is 2 type, and in Ashtanga Hridaya, Acharya mentioned that it is of 8 type. based on the dosha predominance, Vata Rakta is of 8 type. That is Vada, Pitta, Kapha, Rakta, Samsarga, and Sannipatika. Okay, mainly it is 2 type. And one more point, that is here Leilidagi Vasa or Gandhaga Seva is mentioned in the Vadashonidam. Okay, Leilidagi Vasa is mentioned in the Vadashonidam. And the indication for Mahapatmatailam, please note Mahapatmataila indication Vada Asrak Jwara Nashina. Vada Asrak plus Jwara is equal to Mahapatma. Okay. Whereas Buddhaga Padma is indicated for Vadasra plus Daha. So whenever this Daha is associated with this Vadarakta, then Buddhaga Padma Daila is indicated. Okay. Then Vadasra along with the Jwara, we can give Mahapatma Daila. Okay. So this is also an important point. Okay. And Sukumara Daila is indicated in this Vadarakta. Then Amardakya Taila. It is the Agya Taila mentioned in the Vadarakta. Okay, Agya Taila, that is Amardakya Taila. And Kogilaksha Niruham, or Kogilakshaka Kashayam. It's very effective formulation. Kogilaksha Kashayam. That is Kribabhyasa Iva Krodha. It is indicated in Vadarakta. The Kribabhyasa Iva Krodha. It is mentioned in this Kogilasha Niruham. Okay. So we have covered the Vadarakta. Okay, Vadarakta is an important topic. Then coming to the next topic. Okay, so let's start with the Prameha, the next important topic. So, what are the points that you have to know about this Prameha? The type of Prameha mainly. Anyone? Mainly Prameha Bedam. Prameha is of 20 type. Okay, 20. And coming to the dosha pradhanena, it can be classified as Kabacha 10 and Pittaja 6 type and Vadika 4. Okay. And 10 type of Kabaja is Sadhya and the 6 type of Pittaja is Yapya and that of Vadaja is Asadhya. This is 3-star important point. Okay. That is Samakriyatvat, Vishamakriyatvat, Mahatyayascha. Then mainly you have to learn about this type of meha. So I will not repeat the points of type of this Kabaja Prameha, Pittaja and Vadaja. So you have to watch this recorded video. Okay. Then coming to the Purva Rupa of the Prameha, mainly the points is Jadali Bhavam Kesheshu. Okay. And Supta Daha can be occur on this Kara and Pada. Okay, upper and lower limb. And there is a symptom of burning sensation. Okay, and Shatpada Pipaliga Sharira Mutra Abhisarana. That is very important Purvaruba of the Prameha. Okay, so they have a sensation of some ant or this insect get creeping on their body. Okay, so that is important symptom. Then so next point, that is you will get a clear idea about which meha is mentioned and which is not mentioned by acharyas. Okay, so you can refer this table. Then Prameha Hedu is Asya Sugam, Swapna Sugam Dedini, Grami Udaga Anubarasa Payamsi, Navana Panam, Nava Anna Panam, and Budavaigudam. Okay, and all the things that will increase the kaba, ahara and vihara, which increase the kaba, is the nidana for prameha. Okay, you are already studied this nidana, and mainly in which part the sthana samshaya of the prameha is taken place? Vastimuga. Okay, that is an important point. In Vastimuga, the sthana samshaya of the prameha is taken. Okay, then in Pittaja prameha, if Medo Dushti is not taken place, then it is Sadhya. Mainly, Pittaja Prameha is Yapya, but when the Meda is not undergone the vitiation, then it is Sadhya. So, that is one star important part. Then, Prameha Dosha Dosha is very important. So, what are the Dosha? Three doshas, that is Kaba, Pitta, Vada. Along with these dosha, that is Medas, Rekta, Shukra, Ambu, Vasa, Lasiga, Majja, and Dasa, Ojas, and Mams. Okay, so this is the dosha dosha of this prameha, very important. Okay, and we can write this course. In prameha, mainly Lesiga. Okay, Lesiga is very important, and also Vasa, Ambu, Shukra, Rekta males. Actually, the Dadus, Rasa, Rekta, and Medas, Mamsam is present as the Dusha. And along with that, what is present? Lesiga and Ojas. Okay, Ambu. Lesiga, Ojas, and Ambu. And next is to the next point, that is in Prameha Adhikara, Madhva Asava is mentioned, and it is indicated for Kabaja and Pittaja Prameha. Okay, Kabaja and Pittaja Prameha. Coming to the Samanya Lakshana of Prameha, what is the Samanya Lakshana? Avila Prabhuda Mutra. So there is an increased frequency of the urination and turbidity of the urine can be seen. That is Avila Mutrada and Prabhuda Mutra. Very important. Okay. And coming to the Chikitsa Sutra of Prameha, mainly in Stula Pramehi, we can give Samshodhana therapy, and in Krisha Pramehi, we can give Brahmanam. The Brahmanam Tatra Krishasya Karyam. In Krisha Pramehi, Brahmana therapy can be occurred. So Acharya mentioned that the Prameha can be occur as Sahaja and Uttaragalaja. Okay, Sahaja, which is mainly Bija Dushti, is taken place in Sahaja Prameha. Okay, in born, that is history of familial diabetes can be there. So in that type of Prameha, Sahaja Prameha is Asadhya. So Acharya mentioned that point very clearly. Okay. And coming to the Prameha Pidaga. Prameha Pidaga is also important. It is 10 in number. Actually, the Prameha Pidaga is, according to the opinion of this Charagacharya, it is of 7 type. Okay, 7. And Kashyapacharya mentioned 8. And that of Boja. Boja may mention 9 type. And Ashtanga Hridaya and Sushruta Samhita 10. 10 in number. Okay. So you have to remember the 7, 8, 9, 10. These are the order of this Prameha Pidaga. And can you can write the code, that is Charagne कैश देकर, चरग ने कैश देकर भोजन किया. Okay. So इसका हृदय पूरा हो गया. हृदय. Okay. So चरग ने, चरग, and under the चरग you can write 7. चरग 7. And cash means Kashyapa mentioned 8. So under the cash 8. Bhojan kiya. Bhojan. Bhoja mentioned 9 type of pidaga. And Hridaya. Hridaya means Ashtanga Hridaya. Okay, so Ashtanga Hridaya and Sushruta mentioned 10. So this is 3-star important. And in Kashyapacharya, he mentioned Arumshiga as the extra one. Mainly, Charaka mentioned 7 times. And additionally, in Kashyapa, Arumshiga is mentioned. That is, Kashyap ko ek room chahiye. Room. Room means Arumshiga. Okay, Kashyap ko room chahiye. Room means Arumshiga. And in Ashtanga Hridaya, they additionally mentioned 3 Pidagas, that is Vidari, Masuri, and Putrini. Okay, so Masuri means एक पुत्री, उसके नाम विदारी. मसूरी में एक पुत्री, उसके नाम विदारी. Okay, these are the 3 types mentioned in Ashtanga Hridaya. And the Boja mentioned Kulatta. Additionally, he mentioned Kulatta, but he did not mention about Vinada and Masurika. Okay, Vinada and Masurika is not mentioned. So, भोजन के बाद कुलत्थ जैसे एक पिडगा. You can write the code as भोजन के बाद कुलत्थ जैसे एक पिडगा हुआ बिना मसूरी का. So, भोजन mentioned kulatha pidaga and vina masurika means it did not mention about vinada or masurika. Okay. So the number and this name are very important. If possible, you have to study the symptoms of lakshanas of these pidagas. Okay. So in Vidariga, Vidari Kandavat Vritta Kadina Vidariga. Okay, like this, the symptom is very important. And if the Pidaga, which is mainly produced on Uda, Hridaya, Shida, Amsa, Prishta, and if it is occur on the Marmasthana, then it is Asadhya. Okay, so Asadhya stand for this Prameha Pidaga is 1-star important. Then next point, that is about Madhumeha. So Madhumeha, mainly Acharyas mention it as one among the Vadiga Prameha, Madhumeha. But due to the vitiation of this Medas, actually occurring, this Madhumeha can be occur either due to this Dadushaya. Okay, and in Madhumeha, the treatment mainly Svedana Varja. So this is important. That is, in Madhumeha, Sveda is contraindicated. Okay, because in Madhumeha, what is happening? Medo Bahutta. Okay, vitiation of Medas is taken place here. Okay, so by doing this Sveda karma, it will again vitiate the Medas. That is why this Sveda karma is contraindicated in Madhumeha. Okay, so the procedure which is contraindicated in Madhumeha is Svedana. Okay, because in Madhumeha, Medo Bahutva, Svedana is contraindicated. Okay. And we can do Tishna Shodhana in Madhumeha because all the patients are Durvirecha. Okay, that is why Tishna Shodhana is indicated. And then coming to the Chikitsa of this Prameha Pidaga, we have already learned about the type of Prameha Pidaga. If in Apaka Avastha, we can give the Shofa treatment, Shofavat Chikitsa. Okay. And in Paga Avastha, then we can give Vranavat Chikitsa. Then Vranarobaga Taila can be used from the in the acute stage of this Prameha Pidaga. Okay, in acute stage, we can use Vranarobaga Tailam. And coming to the one more point, that is Ubadrava of this Prameha Pidaga is 9 in number. So Ubadrava of this Prameha Pidaga is 9 in number. So whenever we will write the Pidaga with the starting letter P. So when we will reverse this letter P, we will get the number 9. Okay, so Prameha Pidaga Ubadrava is 9 in number. It is also important. And next point, that is, you can see here that that is for the Vranarobhana. Vranarobhana of this Prameha Pidaga, we can use Eladigana. Eladigana for Vranarobhana. And for Udvartana purpose, Aragvadadi. Aragvadadi can be used. And for Parishega, Asanadi or Salasaradi Gana can be used. Okay, so Salasaradi is mentioned by Sushrudacharya. Okay, and Asanadi is mentioned by Ashtanga Hridaya. Okay, and Bojana and Pana purpose. For Pana Bojanartham, Pippalyadi Gana or Valsagadi Gana. Okay, so Valsagadi or Pippalyadi Gana for Pana Bojana purpose. Okay, so you can write the code. That is for Rana Robana, Eladi Gana can be used. So Robana means Eladi. Robana means Eladi. Then Udvartana. So in Udvartana, Aragvadadi Gana can be used for Udvartana purpose. That is Aragudo. So Aragvada you can rewrite as Aragudo. UDU. Aragudo. That is Udvartana. Aragvada for Udvartana. Okay. Then शाला में आसन करने के बाद परिषेक करना चाहिए. शाला में आसन करने के बाद परिषेक करना चाहिए. शाला you can use that salasaradiganam. Okay, and asana, that is asanadi. Asanadi can be used for parishega. So for purpose of parishega, shalasaradi and asanadi. Okay, and for pana and purpose, we can write the code as what people have Pana Anna Samskara. Okay, this is a code. That is what? That is Valsagadi. What? People have this kind of Pana Anna Samskara. So people, uh, that is what for Valsagadi Ganam. Okay. And people have Pana Anna Samskara. Okay. So this is the code for the Prameha or Prameha Pidaga Chikitsa Kashaya Prayogam. 3-star important. And which is the Pramehartha Punarnava? This is a question oftenly asked. That is, which is Pramehartha Punarnava, which is that Shilajadu. So when the Shilajadu is taken in 1 tula, the quantity is 1 tula, then it is known as Pramehartha Punarnava. Okay, that is important. And the yoga or the formulation that we can see that Dhanvantaram Gridam or Rodrasavam is mentioned here. So Dhanvantaram Gridam in the context of Prameha Pidaka is mentioned. That is important, Dhanvantaram Gridam. Okay. And here you can see the Purvarupa, which is mentioned in the Ashtanga Hridaya, that is Kesha Negadir Vritti. Okay, and Karapata Daham Mutre Abhibhavati Pipiligascha. There is a ant or these insects get creeping in the urine. Also can be seen in the Purvarupa of Prameha and Kesha Nagadar Vritti. That is an important symptom. Okay. And also people have a feeling of Hritnetra Jihva Shravanobadev. There is something sticky gets stick on their Jihva. Okay, that is the other Purvarupa important symptom. Okay. Okay, understood? Then moving to the next chapter. Okay, then you can we can study the next chapter, that is Udaram. Udaram is also very important one. So mainly coming to the Pragara of Udara, it is Ashtodari. The name of this Udara that you can pronounce it as Ashtodari, 8 in number. And what are the 8 types? Vada, Pitta, Kapha, Sannipada, and Pliha, Baddha, Shraddha, and Udagodara. Very important. So what are the 4 type extra? That is Pliha, Baddha, Shraddha, and Udagodara. Okay. And in this chapter, Acharya mentioned that Yogaha Sarve Abhi Mandayakmu. So you can see a quote in the Ashtanga Hridaya, that is all the diseases are mainly caused due to the Mandakni. Okay, Mandakni. And In Udara, mainly Sthana Samstraya is taken place between Tvak Mamsandara. Okay. So here you can write the code as TUM. So in Pandaroga, we have studied that with the code TPM, that is in between Tok and Mamsa. And in Udararoga also, the samstraya is taken place between Tok and Mamsa. Understood? Okay. Then, next point, that is about the Udararoga Purva Rupa. Okay. So in Udararoga Purva Rupa, mainly Jirna na Veticha. That is an important symptom. Okay. And Raji Janma Vali Nasham. That is very important. Okay. Raji Janma Vali Nasham. So mainly there is abdominal distension. Okay. And then this kind of gravida or some stretch marks can be appear due to the stretching of this muscles. Okay. So Raji Janma Vali Nasham. That can be occur as a Purva Rupa of this Udara. And coming to the Udara Roga Samanya Lakshana, Kukshir Admanam Adoba and Shofaha Pada Karasyacha Mandagni Shlekshna Gandatvam Karsham Chodara Lakshana. So the Samanya Lakshana is very important. So you can imagine a person with distended abdomen. Okay, distended abdomen, and of course he is having Mandagni. So whenever this abdomen is distended, so there is a chance of Mandagni, and also he is having edema on his hands and foot. Okay, edema. But his body is very lean, and he is Krisha. And Preda Rupa Purusha, Acharya Vagbada mentioned that totally they have a scary look. That is Preda Rupa Purusha. The person is Krisha, but the abdomen is distended and with the shofa on his hands and feet. Okay, this is a Samanya Lakshana of Uttara. Then coming to the Lakshana, mainly you have to study the Plehodara Lakshana. Okay, and in Plehodara Lakshana, mainly Kachaba Samsthanam. So the abdomen has a shape of Kachaba. Okay, Kachaba Samsthanam is a Vriddha Pleha Surubam, and Tama Pravesham associated with the Kasa Shwasa and Parvaveda can be occurred. So Plehodara Lakshana it is Kachaba Samsthan, and Vama Parsha Ashridaha Pleha Chuda is only occurring in the Plehodara. Okay, so Vama Parsha Ashrida is the another important symptoms you have to note in the Plehodara. And next is Baddha Gudodaram. Baddha Gudodaram is occurring due to the obstruction of the mainly obstruction produced by Pakshma or any foreign materials. Okay, and this is known as Baddha Gudodaram. Actually, the obstruction is taken place here. Okay, and mainly Abhana Marga Samrodhat Hatva Agnim Kubido Anilaha. Varchaha Pitta Gaban Ruddan Janayat Yatudaram. So Baddha Gudodara mainly Abhana get obstructed here. Okay. Then next important point about this Udara. That is in Udara. What is happening? Vadadi Dosha Koba is occurred. Okay. And one more point, that is Dushya, which is mainly present in the Udara is Rekta. So Sudhajarya mentioned Rekta is a dosha in Udara. Okay, and the type of Raji, that is Neela Haridra Raji, can be seen here. Neela Haridra Raji is the type of stretch marks that can be seen in the Plehodara. And Plehodara is of 5 types. Okay, 5 types. And it is Kachaba Samsthana or Ashtila Tulya Vriddhi can be seen, and Tama Pravesha is also. So what are the important points in the Plehodara? It is fire type, and mainly Astrakrita is the dosha, and Kachaba Samstana or Ashtila Tulya and Tamaga Pravesha. Okay. And coming to the Baddha Kudodaram, we have already mentioned about the Nidana, that is foreign materials, especially Pakshmawala in food, and Andhra Ubalebam and Andhra Sammurchanam can be occur here. Okay. So Andhra means like a Bandh. So you can imagine like Bharat Bandh is also present in the Andhra also. Okay. Andhra means here Andhra Sammurchanam and Andhra Ubalepanam. And Bandh, that is Baddha Gudodana. Okay. Understood. And here, what will happening? There is obstruction for this Mutra, Varchas and Vada. So these all get obstructed here. And Shardi, with Samaganda Shardis occur in the Baddha Gudodara. Okay, with Sama Gandha can be seen in the vomitus. Okay, important symptom. And next point that regarding this Baddha Gudodara is Gopuchagridi. Gopuchagridi above the Nabi. So above the Nabi, it's similar to the Gopuchagridi. So that the sthana of this Baddha Gudodara is in between Hridaya and Nabi. Okay, so Baddha Gudodara can be occur in between Hridaya and Nabi, and it's similar to Gopuchagridi samstana. Okay. Then next is Chidrodara. Okay. So we have learned about Plehodaram and Baddhodaram, and next is Chidrodaram. And its synonym is Shadodaram, Parisravi, Udaram. So these are the two synonyms. Parisravi and Shadodaram are the synonyms for Chidrodaram. Okay. So you can write code for it. Okay. If an injury or Shada is occurred, then that will cause Chidra. Chidra ho to kya hoga? Srav hoga. So Shada, first Shada is happening, then Chidra ho to Srav. Parisrava, Chidra or Shadodara. Okay. And the Srava can be seen as the Punaba Ama. Okay, Punaba Ama Gandha can be seen as in the Chidrodara. Okay. So in Chardi, which is similar to that of Vitsama, is seen in the Vichudara Baddha Gudodara. Okay. Whereas this Srava, which is similar to Punaba Amagandha, can be occur in Chidrodara. Okay. Then suddenly this Chidrodara can be turned into Jalodara. So prior to the stage of Jalodara, which is the stage Chidrodara. Okay. And we have to learn about Jalodara. Jalodara mainly it has 4 stages. Okay. The stages of Jalodara is very important. It has 4 stages. And Shadaha Vardamano Udagodara. So whenever this Shadodara increase, then it will be transformed into the Jalodara. Okay. And its symptoms are Udagapurna Dridisparsha. And Nana Varna Raji. The color of Raji is Nana Varna. Very important. Okay. So Nana Varna Raji is also occurring in the Sandipadodaram or Dushodaram. So please note Nana Varna Raji is present in Dushodara. So Dushodara means Sandipadodara as well as in Jalodara. Okay. And the 4 stages of Jalodara are first Ajadodaga Udaram. Okay. So in this stage, the abdomen is filled with air. Okay. Vayu. Ajadodaga Udaram. And next is Picholpatti Udara or Jalajanma Purvarupa. Picholpatti Udara or Jalajanma Purvarupa. And next is Udaga Pradurbhava Lakshana. And last stage, that is Ubadrava Yukta Udara. Okay. Ubadrava Yukta Udara, it is Achigilsya. That is, it is Asadhya. And it has a complication like Adisaram and vomiting. Okay. Chardi and Tamaga. The complication mainly Tamaga, Adisara, Shardi. Okay, so you got the 4 stages of Jalodhara. Now, the number is important, the names are important. Okay. And next point, that is the Sadhya Sadhita of Udara is also important. That is Vata, Pitta, Kaba, and Pliha, Sannipada, Jalodhara are Uttarottara Kruchra Sadhya. Okay. So, Vata, Pitta, Kaba, Pliha, Sannipada, and Jalodhara are Uttarottara Kruchra Sadhya. And that of Baddha, Pliha, Chidra, Jala are Shastra Sadhya. So, please note Baddha, Pliha, Chidra, Jala. That is 4 type that we have discussed. That is Udara is 8 type. That first 4 are Dosha Pradhanika. Okay, and the remaining 4 are Baddha, Pliha, Chidra, Jala. So that 4 type of Udara are Shastra Sadhya. But in Ashtanga Hridaya, note that in Ashtanga Hridaya, Acharya mentioned that except Plihodara, other 3 Udaras are Shastra Sadhya. So in Ashtanga Hridaya, Plihodara is not indicated for the Shastra. Okay, Shastra Karma. Understood? This is important point. So all these last 4 type of Udaras are Shastra Sadhya, except Pliha. In Ashtanga Hridaya, he mentioned that it is Shastra Sadhya. Okay. And other 4 type are Aushadha Sadhya. And next important point, that is in Chidrodhara as well as the Baddodhara, that will kill the patient within 15 days. Okay. So death can be occur within the 15 days in Baddodhara and Chidrodhara. So how will you remember it? So please note this code, that is BC 15. B for Baddha and C for Chidrodhara, and it will kill the patient within 15 days. Okay. Okay. So the Sadhya Sadhya is very important. Then coming to the treatment aspect of Udara, mainly Nityamena Virejana is mentioned by Acharya. So Virejana can be done daily in Udara. Okay. And also we can use Shira. That is Prayoganam cha Sarvesham. Anukshiram Prayojit. So Shira can be used for the treatment of this Udara at any condition. Okay. And in the Vadiga Udara, mainly the Virejana with Eranda Taila with the Motra or Shira is indicated. Okay, that is 1 star important. And Uddara Veshtana is indicated in Vadiga Udara. So in which type of Udara the Veshtana is indicated? Vadiga Udara. Okay, so while studying the Prasudi Tantra, we have studied that in the Prasudiga, the treatment of this Prasudiga or Prasudi Chedya, Udara Veshtana is indicated. And another disease in which this Udara Veshtana is indicated is the Vatiga Udara. Okay. And if Udavarta is associated, then Kashaya Vasti and Dashamulika Vasti is indicated. And in Sushruta Samhita, Salvana Ubanaha is also indicated in Vadiga Udara. So the treatment aspect of Vadiga Udara is 2 star important. And coming to the Kabaja Udara, we can give Kshara Taila for Pana. Okay. And Churna Ayaskriti. Please note, Churna Ayaskriti is mentioned in the Kabaja Udara. Okay. Kabaja Udara. Churna Ayaskriti. So Ayaskriti in the Churna form. Okay. And the treatment of Plihodara. What is the treatment of Plihodara? Mainly Siddhavyada. Okay. This is oftenly asked question. In Plihodara, which is a treatment? Siddhavyada. In which part? Vamahasta and Purpara Abhyantara. Okay. Mainly we can done this Siddhavyada on Vamahasta. So in Plihodara, it can be done in Vamahasta. But in Yagrudodara, this Siddhavyada can be done in right. Okay. Right hand. Dakshinahasta. Okay. Then next is in Baddha Udara, Snehapana is contraindicated, and here Tikshna Virejana is indicated. So Baddha Udara, actually what is happening, there is obstruction. So Snehana cannot be done. So in that purpose, we have to remove that obstruction. So Tikshna Virejana can be done. Okay. Then next is Chidrodara. Chidrodara is also Sneha is Sweda is contraindicated, and we can give Kabacha Udara Chigilsa. Okay. And in Chidrodara, Jadam Jadam Jalam Sravyam is indicated. This quotation is important. That is Jadam Jadam Jalam Sravyam. That is the water, the fluid should be removed. When this abdomen is get filling with this fluid, it should be frequently drained out. Okay. So that can be done in Chidrodara. Okay. So don't get confused that it is done in Jalodhara. In Jalodhara, that can be done, but this quotation, that is Jadam Jadam Jalam Sravyam, is mentioned in the Chidrodhara treatment. Okay. Then in Dushodhara, the point that you have to remember is Visha. Visha can be given for the treatment of Dushodhara. Okay. So Krishna Sarpa Visha or Stavara Visha, like Guncha, Karaviraga Visha can be given in the Dushodhara. Okay. That is very important. So in which Udara, Visha is indicated as a treatment? Dushodhara. Okay. And Abham Dosha Hara treatment. In Jalodhara, which is the mainly vitiated, or the water or the fluid get filled in the abdomen. Okay. So Abham Dosha Hara treatment is mentioned in Jalodhara. Understood? So I think you get confused with all the treatment. That is Jalodhara, mainly Apam Dosha Hara treatment. And in Chidrodhara, Jadam Jadam Jalam Sravyam. And in Dushodhara, main point, that is Visha. Visha can be given. Krishna Sarpa Visha, Guncha Karavira, Kagadani Visha can be given here. Okay. And in Yagurt and Plihodhara, mainly Siravyada is indicated. Okay. And the Shira Prayoga. Shira Prayoga, Takra Prayoga, these are important in the Udara. So the Shira Prayoga, mainly Mahisha. Mahisha milk can be given for 7 days. 7 days for Mahisha milk and 1 month for Ushtrapaya. Okay, 1 month for Ushtrapaya and 3 months for Ajakshira. Mainly, we can give Ajakshira for a long period. That is 3 months. For 3 months, Ajakshira. And Mahishira for only for 7 days or 1 week. And 1 month for Ushtrapaya. Okay. This is 3-star important point. And next is Takra Prayoga is also mentioned. Mainly in Takram Vada Kabarthana. So if the Udara Rogi is complaining of Gaurava or Arojaka. Okay. And Mandakni and Adisara. Gaurava, Arojaga, Mandatni, Adisara is present. In that case, we can advise Takra. Okay. So in Grahani, Arshas and Udara, these three diseases, mainly Takra is the main treatment that we can advise. Okay. So please note the disease, that is Grahani, Arshas and Udara. And in the Udara, if the patient is having heaviness, Gauravam, Arochagam, Adisaram, and Mandakni, then this Takra is advised for pacifying this Vada and Kapha. Okay. If the patient is having Shofa and also Atmana, Ruk, pain is present and edema is present, and that Karabi Kshira can be used. Okay. Karabi Shira means Ushtrapaya. Okay, Karabi Shira is indicated when there is edema as well as pain is associated. Okay, that is also important. Karabi Paya. And we have to learn about the important formulations in the Udara Roga Chikitsa, that is Ashtamutra Prayoga. Very important. Please note, Ashtamutra Prayoga is indicated Ashtodariya. Okay, so got the thought? Ashtodariyam, Ashtamutra Prayoga. Okay. And Panchakola Gridam, Agara Gridam, Chitraga Gridam is indicated in the Udara. So Nagara, Panchakola, and Chitraga Gridam. And Padoladi Churna, Narayana Churna. So the Grida, what are the Grida mentioned Udara Chikitsa? Nagaram, Panchakolam, and Chitraka. Okay, these are of 1-star important. And the most important yoga in Udara Roga Chikitsa is Narayana Churna. Okay, so it is the quotation is given for this Narayana Churna as Vishnu Asura Iva Rogana Abhivardade. Vishnu Asura Miva Rogana Abhivardade. So this is the quotation or indication given for Narayana Churna. It is a extremely effective yoga for the Udara Chikitsa. Okay, so in this chapter, the different anupanas are mentioned for different diseases in which the Narayana Churna can be given with these anupana to cure that particular disease. Okay, so you have to study that. So for the Udara, Narayana Churna should be taken with the Takra. Okay, so it should be taken with the Takra in Udara. And in Gulma, it can be taken along with the Badarambu. Okay, and in Anaha Chikitsa, Sura is the Anupana for the Narayana Churna, and in Vada Vigara, Prasanna is the Anupana. And for Malabandha, Dadi can be taken, Dadi Manda can be taken, and for Ashas, Dadima Ambu. Dadima Ambu can be taken as Anupana, and Vrikshamla can be taken for the Padikartiga, and the last one, that is Ushnodaga, can be taken for Ajirna. Okay, so let's write some codes. That is Nudara Takra. So you can write the code UT. For Udara, Takra can be used. Bad Gulma, that is Badarodara, can be used in Gulma. Okay, so never forget that these Anupanas are mentioned in Narayana Churna. Okay, so bad Gulma, Badarodara in Gulma, and Vada Prasanna. That is in Vada Vigara, Prasanna can be given. Vada Prasanna. And Daddy and mom for Arshis. Daddy and mom for Arshis. So Dadima Ambu. That is daddy and mom. So together we can read Dadima Ambu. Okay. Daddy and mom for Arshis. So in our Daddy, Dadima Ambu is the Anupana. And उष्ण काल में जीर्ण जीर्ण होगा उष्ण काल में जीर्ण अजीर्ण in hot water. Okay, उष्ण काल means उष्णोदक. Then Vrikshakarta. For Parikartika, we can give Vrikshamla. So Vrikshakarta. And Anasura. Like anaconda, like this, you can use the code Anasura. That is for Anaha, Sura is indicated. Okay. And last point, that is Vibandha. Okay. बंद में दादी के साथ मंड पिया. बंद बंद. Okay. बंद means विबंध. दादी के साथ मंड means दादी for dadi. Manda. So dadi manda is actually mentioned for the as anupana for vibandha. Okay. So this is very important. You have to study each anupana and the corresponding disease also. Okay. And what about the surgical procedure in the Udara? That is also important. So in Baddha and Shadodara, the incision should be made below the navi with a 4 angula in length. Okay, the incision is 4 angula in length for BC, that is Baddha and Chidrodara. And for Jalodara, the incision is 1 angula. That can be done with the Vrihi Muga. And the draining of this fluid can be done with the Nadi Yantra. Okay, so which is the Shastra mainly used for the draining? That is Vrihi Mugam and Nadi Yantra. Okay, so don't forget Vrihi Mugam and Nadi Yantra. And the incision of Jalodhara is 1 angula in length, and that of BC, that is Baddha Chidrodhara, it is 4 angula. So that Pramana is important. Okay, and also Habushadi Churnam, Nilinyadi Churnam is indicated here. Mainly we can use Guggulu Vardhamana Prayogam, Pippali Vardhamana Prayogam, and mainly Snuhishira Bhavida Pippali is used. Okay. So Vardhamana Prayoga, that these all can be taken, that is in 1000. Okay. Sahasra Vardhamana Prayoga. That is Pippali and Guggulu can be used as a Dasayana Prayoga. Okay. Vardhamana Dasayana. Pippali and Guggulu. So you can write the code as good people. Okay, people, whenever the term people is present, that is Pippali. So good here for Guggulu. Okay, good people is a rasayana used in Uttara. Okay. So we have covered the Udara Chikitsa also. This is very important. We have covered the Prameha, Udara, and Vada Shonida, and Pandu Kamala. And I would like to share one more chapter. Okay, Dr. Rasia, can we start another chapter? Dr. Rasia, do you have any doubt? Okay. So let's start the Rajyakshma. So the points that you have to remember in the Rajyakshma is the 4 poses of this Rajyakshma. Rajyakshma, okay? 4 poses. That is Sahasam, Sandharanam, Shayam, Vishamashanam. So these 4 are very important. And the Padyaya or the synonym for this Rajyakshma is given in the Charaka Chikitsa, that is Krodham, Yakshma, Jwaram, Rogam, Dukkam. Okay. This is also important. And coming to the Purva Rupa, you have to remember that is 3 Kamada and Mugasya Padayoscha Shofaha. Mugasya Padayoscha Shofaha. So in Udara, in Samanya Nidana of Udara, mainly edema can be seen on the foot and hands. But in Purva Rupa of Rajyakshma, Mugga Pada Shofa is present. Okay, that is important. And you have to study the Ekadasha Rupa, Shad Rupa, and Tri Rupa of the Rajyakshma. That is very important. Okay. So I will not explain these points. This is very important, and we have studied these points in the recorded videos. Okay, and I have shared the code also. Okay, so you have to learn that it is 3-star important point: Shadruba, Triruba, and Ekadashi Rupa. Then next, that is a Samani Lakshana, that is Amsa Parsha Abhitaba, Sandavaha Karapadyoho. So Karapada Sandabam and Jwara. Sarvanga Jwara is the 3 symptoms of this Rajyakshma. Very important. Sometimes it is mentioned as a Triduba also. Okay. And Sarvadadu Kshayartasya Balam Tasyahi Vidbalam is mentioned in this Rajyakshma. Okay, that is very important. The importance of Malareksha in Rajyakshma. Okay, Rajyakshma patient. So Sarvadhatu Shayartasya Balam Tasyahi Vidbalam. Then in the Rajikshma Nidana, there is also explained the type of Swarabheda. So Charakacharya mentioned the type of Swarabheda here, that is 6 type. Mainly uh, Rektaja, that is Vada Pitta Kabaja, along with the Rekta Kasta Pinasa is included as the type of Swarabheda. So Swarabheda is 6 in number, actually. So in Charaka Samkhida, the 6 type of this Swarabheda, that is Rekta, Kasa, Pinasa. These 3 are additionally added. Okay. Then Rajekshma means Shardika Karan, that is Arochaga, Kasavega, and Doshulklesha. These are of 1-star important. Okay. And in Rajekshma, the treatment of Pinasa is important. So in Pinasa, mainly Sweda Abhyanga is mentioned, and also Dupana is also mentioned. Okay. And Parishega, Nadi Sweda, Ubanaha Sweda. So the type of Sweda mainly mentioned in the Rajekshma is Sangaram, Parishegam, and Nadi Ubanaga Sweda. So these 4 type of Sweda is mentioned in Rajekshma. Okay. Then coming to the Ubadrava, mainly 7 type of Ubadrava is mentioned in Rajeshma. Okay, so Ubadrava of Rajeshma is 7, and Nidana of Rajeshma is very important. It is 4 in number. And next is, if the Kshaya mainly caused due to the Vardhakya, that is Vardhakya Janya Kshaya, the sound is like Binna Kamsya Patra. Okay, Binna Kamsya Patra without khab. That is important. That is in Vardhakya Janya Kshaya, the sound is similar to that of Binna Kamsya Patra. Okay. Then next is the important Chikitsa in the Rajekshma, that is Rekta Moksha. Rekta Moksha is indicated in Rajekshma, in which part? Shiraha Parsha Amsa Shula. Okay, Shiraha Parsha Amsa Shula. These are the area where this Rekta Moksha is indicated. Okay, so Shiras, Parsha, and Hamsa. Okay. Then the treatment principle, that is Belino Bahudoshasya. Snigdha Sinasya Shodhanam. Urdado Yakshmano Kuryat. Okay, this is the main treatment, that is Samshodhana is indicated. And the yoga such as Swadamstradi Gridam. So please note Swadamstradi Gridam and Jivandyati Gridam is mentioned in the Rajekshma. So Shodamstradi Grudam, very important. So Shodamstradi and Jivandyadi. Jivandyadi is Roga Rajaharam Param. Roga Rajaharam Param is it is mentioned for Jivandyadi Grudam. Okay. And in Tali Sadi Churnam. So commonly we use the Tali Sadi Churnam for Muda Vadanulomanam. So it is indicated for Muda Vadanulomanam. So Tali Sadi Churnam is indicated in Rajekshma Chikitsa, and Sidopaladi Churnam. It is mainly mentioned for Soidyam. Okay. Soidyam, Sidopaladi Churnam, and Shadpalagridam. Shadpalagridam, which is mentioned in Ashtanga Hridaya in the context of Rajekshma. This is Shrodasam Vishodhanam. So it is Shrodasam Vishodhanam. Shadpalagridam is very important. And next is Pancha Panjamuli Shiragridam. Pancha Panjamuli Shiragridam, which is Saptagam Balam, which is indicated as Saptagam Balam. Okay. And Eladi Krida in Ashtanga Hridaya and Sushma Samhita, Eladi Krida is mentioned as Rasayana. Okay. And Dashamula Shrida Navasarpi is Param Swara Bodhanam. Param Swara Bodhanam. That is Dashamula Shrida Navasarpi. Okay, so I hope you noted these yogas. So, Shodamstradi Vridam, Jivandyadi, Talisadi Churnam, and Panjamuli Kshira Gridam, Eladi Gridam, and Dashamula Shruddha Navasarpi. Okay. And another important treatment in the Rajeshma Chikitsa is Mamsa that should be given by changing its name of the Mamsa. It is known as Jugupsa Chikitsa or Chatmoba Samhita. Okay. In order to avoid that Chardi, some people have aversion towards some kind of meat. So in order to avoid that, this Jugupsa Chikitsa is indicated in Rajeshma. Very important. Another name for Jugupsa Chikitsa is Chatmoba Samhita. Okay, Chatmoba Samhita. And the mainly the meat which is indicated for Pitta Kabadiga type is Mriga and Vishkira. Mriga Vishkira Mamsa for Pitta Kaba, and that of Prasaha Mahamriga Mamsam for Vadika. Okay, Prasaha Mahamriga for Vadikam, and for Pitta Kaba, Mriga Vishkira. Okay. And coming to the next important treatment, that is Bahir Marjana Vidhi, external therapy, which is indicated in the Rajeshma, is Abhyanga with the Mishraga Sneha. Okay, so Mishraga Sneha, mainly it is indicated in Gulma Chikitsa. Okay, but it can be given for Abhyanga in Rajeshma. Okay, that is the external therapy, very, very important. And for Udvartana, Jivandyadi Churna is indicated. Okay, so Jivandyadi has this Brahmana property. So in Rajeshma patient, there is a Shaya is taken place. Okay, so in that purpose, we can use the Jivandyadi Churna for the purpose of Udvartana. And for Abhyanga, Mishraga Sneha can be used. Okay, and Pippali Vardhamana is also indicated in Rajeshma Chikitsa. And mainly the Aja Mamsam, Aja Shagrat, Aja Mutram, Aja Paya, Aja Rekta. So the Shagrat, Mutra, Rekta, Payas and Mamsa of the Aja or God is indicated in the Rajeshma. And Acharya also mentioned the staying for a long time with this God is indicated in Rajeshma. Okay. Please note that Aja, Mutra, Shagrat, Paya, Rekta, Mamsa is indicated here. And coming to the next important point in Rajeshma, you have to notice Yakshma na labade andaram. Very important quotation. Yakshma na labade andaram. That means those people who use the mamsa shanam, use the mamsa and mardhigha, madhya and avidarida vega. These three kind of persons will not affected with this Rajyakshma. Okay, that is Yakshma na labade andaram. Madhigam, Avidarida Vegam, and Mamsa. Okay. And if the Adhisara is present in Rajeshma patient, we can give Grahani treatment, and also Adhisara treatment can be adopted. And in case of Prasega, so Prasega is the common type of complication which is associated in the Rajeshma. So mainly Vada Kaba dosha is the doshic predominance of Prasega, Vada Kaba. Okay, so in Prasega, which dosha? Vada and Kaba. Okay, and we can give Snigdha Ushna treatment in the Prasega, and also Jangala Mamsa is also advised. Okay, so Snigdha Ushna Prayoga and Jangala Mamsa. So Prasega, which dosha is predominant? Vada Kaba. That is important. And also external therapy, we can use Jivandyali Churna for Udvartanam, and for Abhyanga, Mahasneha can be used. Okay, and the four courses of Rajeshma is very important, and the Shadruba, Egadasham, and Triruba are important, and also Shodamstradi Gridam, Jivandyadi Gridam, and this Panjamuli Gridam also important. Okay, so these are about this Rajeshma, and we have covered this topic also. Okay, Dr. Preesha. And we can continue the remaining chapters in Kachikitsa in the coming class. Okay. Preesha, what about the class? Do you understand the important points? Okay, so let's wind up today's class. Okay, so in the next class, we can cover the important portions in the Kaya Chikitsa. Okay. Okay. Good night. Bye.